In today's session, I will present our study regarding an intratumoral port device. Basically, it's a preclinical study. We develop a catheter specifically designed for intratumoral injection of drug, for example, immune therapy or chemotherapy. Our preclinical data showed that this newly designed port, compared to a traditional catheter, is able to get higher local drug concentration and also to retain the system in the tissue.
In today's session about breast cancer, it is a basic course and we will be talking about all things breast cancer, specifically, again, minimally invasive technique with breast cancer. So we'll talk about pathology, the different pathologies, the different ablative techniques, and then we'll look towards the future, what is coming up on the horizon, how we can use it to improve survival in our patients. We're just on the verge of using cryoablation and other ablative techniques to improve survival by using abscopal effects. We're right on the verge of introducing it to clinical practice.
On our session, we're going to discuss about the ESMO guidelines. I'm going to specifically talk more about the NCCN guidelines from the United States part, and also there will be a piece about discussing on the role of SBRT for colorectal cancer liver metastasis. And then we're going to have a number of cases that we're going to discuss on a multidisciplinary fashion. So we're going to discuss how those trials that have been recently published have already changed the guidelines to treat patients with colorectal cancer liver mets and how we should incorporate that on our clinical practice.
Well, in today's session on kidney cancer management, I think there's a lot happening. We've reached a level of maturity with ablation. It works. We'll talk about that and the finer points of ablation and how to really deal with slightly more complex disease. The other really important take-homes are our interface with radiotherapy. And then finally, the other evolved area is combination immunotherapy. There's lots of combination and effective combinations, but can we contribute to that with local regional therapy?
Interventional oncology changes lives, and this is particularly true in pediatric patients. So this is an emerging field, and we need to work on it very hard to develop those techniques and to offer those new techniques to little patients as well. My lecture is about mediastinal biopsies in children. So sometimes you have biopsies in very tiny babies, sometimes you have teenagers, and you need to deal with all those patients. And so I will share some tips and tricks from the literature, from my experience as well. And then my other colleagues will discuss very challenging cases as well. So we will talk about very basic things and very challenging cases and with new procedures as well. So we will be more than happy that you come and join us.
Interventional oncology is not only treating liver, lung or kidney disease, it's also MSK oncology. And in today's workshop we are dealing with exactly this topic. We help our colleagues doing the right diagnosis by biopsies. We treat our patients either together with our surgeons when we do embolization on tumors to avoid blood loss, or we can also treat patients in palliative situations using heat-based or cold-based ablation methods, and the new kid on the block, the electrochemotherapy. And in today's workshop you can have a hands-on session, you can see all the material, you can work with it, and you can ask all the questions you wanted to ask.
At Boston Scientific, at the 2025 edition of ECIO, we are focusing on TheraSphere, which is now 20 years in the European market with over 30,000 patients successfully treated, with its engineered technology for maximum radiation to destroy the tumor while protecting the surrounding tissue. We welcome everyone at our booth to share, to interact, and to learn about our platform, our technologies, and our clinical evidence strategy.
At ECIO, Siemens Varian is fortunate to be able to showcase 2 new product lines that we think will help shape the future of interventional oncology and minimally invasive therapies. The first is myoablation planning and confirmation software, which will allow the physician to better segment and identify the tumor, but to make sure that we're able to treat that tumor with adequate margins. The second product is our latest microwave ablation probe, which combines all the state-of-the-art technology, all user feedback from decades of experience incorporated into a single product. We will be showcasing that during our symposium today. We're really fortunate to have the opportunity to present something informative that I think physicians will benefit from. We also have a second product called IntelliBlade, which is our microwave ablation platform. It combines all the elements of what we know today regarding microwave ablation, combined with physician feedback, integrated into a new platform that I think will be state-of-the-art for ablative therapy.